Hi, this is Brandon with Chiro, and I want to bring to your attention a cool new paper that just came out in Spine this year. And this paper is one that I've been looking for a long time. And the reason is I do a lot of speaking and I always refer to the arm squeeze test. In fact, we wrote a blog upon that about 2 years ago. I'll post the link at the bottom of this page. And it was one of our more popular blogs because it's ridiculously easy to do and its sensitivity and specificity are ridiculously high for differentiating between a cervical radiculopathy and a shoulder condition. It's not very specific as far as diagnosing what kind of shoulder problem you may have. That's what our orthopedic and functional exams are for. But if you want to differentiate what you're looking for as far as is this a neck problem or a shoulder problem, it is very good. One of the issues that I had is that there weren't a lot of papers on the arm squeeze test, and a new one just came out incorporating into a clinical prediction rule for documenting is a cervical radiculopathy or is it something else. And as it turns out that when you can use that test in conjunction with the Furlings Test, the arm squeeze test, and then also the axial traction test, that these things in combination indicate that you have a cervical radiculopathy. So here's Furlings Test. With Furlings Test, we're going to see that you're going to add some lateral flexion and compression down the cervical spine, and when there's irritation at that neural foramen, that we have reproduction of symptoms. That's an important thing, that when we do an orthopedic test, that we have reproduction of those symptoms, in this case being a radicular pain, throb, numbness, tingling, burning, extending down into the arm. The next test is axial traction. This is going to give us the exact opposite effect, is that when we actually pull up on the spine and distract the spine, now we're seeing a centralization or alleviation of radicular symptoms. And the last one here is the arm squeeze test. While squeezing the arms about 2 pounds of pressure, you're going to get reproduction of symptoms extending down the arm, or if it's a shoulder pain, you're not going to get any change in symptoms. So here's why that's important, is because I see so many videos of marketing people online, and they look at reproduction of services, and you want to make sure everything's standardized and get new patients in the door. But realistically, what are you going to do with those patients once they get in the door? The most important thing you can do for them is to provide them with a diagnosis. Your job is not to treat every patient that walks in your door. Your job is to diagnose them. Now, for a lot of those patients, they're going to fit into your model of care and a diagnosis that you can help with. But making the differentiation between a neck problem and a shoulder problem will make all the difference in their treatment outcomes. One of the most important parts of Chiro is not marketing your services. It's not saying what specific treatment you do. It's marketing your outcomes. So now when you go talk to the public, when you talk to Google and we talk to your medical providers, you can tell them and you can show them your clinical results and see what you can do well, what you can't do well, and then hopefully we provide you the services and the education on how to get those things that you're maybe not treating well and improve those outcomes. Check us out at Chiro. Check out that last blog on the arm squeeze test, and I hope you appreciate this blog. Highly recommend looking at those 3 tests. Once again, the arm squeeze test, Furlings test, and axial distraction. You incorporate all those things into one with that patient, you can be sure that now you have a cervical radiculopathy instead of just a shoulder pain mimicking as an arm complaint.